Hey guys, my name is Andy. If you're new around here, I like to look at emergency services body cam videos and stuff like that. So here we are. We've got one from England, I think, my hometown.
55.
A 000 call has come in from Woodridge.
Okay, straight away. This is not England. Do not ring 000 in an emergency. You ring 999 if you're in England. I think, don't quote me on this, but I think if you ring 000 or 911 from England, it still puts you through to the emergency services. This is because it's been used so much in films that kids think that 911 is the emergency services in England, and that could be the other way around too. If you're in America, you might think 999 is the emergency services, but less likely. But yeah, 999 if you're in England.
Colour?
It's a bit white, grey.
And is it claiming you're having cold sweats?
Yeah, he's
Okay, cold sweat straight away, pings my head off and goes heart attack.
having cold sweat.
A man has collapsed on the ground with a suspected heart attack.
Does he have difficulty speaking between breaths?
Yes.
2 emergency vehicles are dispatched. Ambulance 1478 is the nearest available crew, 4 minutes away. Critical care paramedic Sophie is also dispatched. She is 6 minutes away.
When I applied to become a CCP, I was coming into it as a bit of a minority, being like a young female in maybe an older male population.
Don't you worry about that in critical care where I worked. I've changed jobs now, but where I worked, there was about 50 females and about 5 guys.
Role, but I mean, it's becoming more diverse and there's a lot more females in the roles, so it's exciting to be part of that change. The best bit about the job is being able to help someone in the worst day of their life.
CCP Sophie has a higher level of medical training, allowing her to take the lead in more extreme situations.
Level 37, the crew have advised they now have to complete heart block, small episodes of conscious VT, and it's now reverted back to heart block.
Roger, not long away.
Heart block is where the heart beats too slowly, while VT is caused by improper electrical activity in the heart.
Yeah, so it sounds more than a blockage. It sounds more like he's got a problem with the electrical pathways of the heart. These down under, they're using different terms like heart block, where VT we use worldwide, ventricular tachycardia, where the heart's just doing this rather than pumping properly. It's just like fibrillating a bit. Well, tachycardia, it's fast.
The patient is suffering both, each of which is life-threatening.
Thank you. Hello, hey guys.
Okay, so this lovely gentleman, 55 years old, had some pain yesterday, which self-resolved. It's happening about 1 o'clock. He's had an onset again of the pain. 1 o'clock this afternoon, central chest significantly reduced. With right arm radiation significantly noisier. Yeah. So I need to ask you a heap of questions, okay, mate? If you are having a heart attack, we want to give you a few more medications, all right? Okay.
Hey, how you going? Can we start with just a stretcher at the bottom and a stair chair? Thank you.
All right. You're not on any current anticoagulants? No blood thinners? No? All right. No active bleeding at the moment. I know I did ask you before. You haven't had any blood in your poos, wheeze, nothing? Have you heard of something called haemophilia?
Do you want a right side or anything like that? We'll just get a V4R.
You haven't ever been
Just
told
a
you've got
V4R.
any issues with clotting disorders? No. So no issues with...
with the blanket, please.
Mate, we're going to do the best we can, but we're actually going to take you down a staircase soon and we won't be able to have a blanket on you, okay?
Yeah.
Well, so let's sort the heart out and we'll get you warm as soon as we can.
Oh, no.
Yeah, can you crack a heating blanket down the bottom? Heating blanket down the bottom? So I've got a...
It's going good.
Is it gone? It was a 7 when we got here. Have you got pain still?
No.
No, okay.
No pain.
You could be wrong about heart attack.
Look, this is what we're trained in sort of identifying. So you have a little blood clot in one of the vessels in your heart that's occluding blood flow. And
You know that now.
Based off the ECG changes that we're seeing, we're pretty highly trained in this sort of thing. The good thing is your heart rate's picked up a little bit more and your blood pressure's looking really good.
Alright, we're going to get you up, we're going to help you onto this chair. Once we get you on the bed, we've got a blanket heating up ready for you, okay, to try and get you a bit warmer.
And sorry, your name, sorry? Kevin. Okay, we'll start extricating. When we're doing this, can we have one person looking at the monitor at all times, all right?
Yeah.
The major risk here is that his heart attack will turn into a cardiac arrest. The outcomes can vary. The outcomes can be really great and that person might walk home with no troubles versus that patient might not survive at all.
The patient appears to be stabilising, but the blood clot means he's still at high risk of slipping into ventricular fibrillation, or VF.
Let's crack on. All right, sweet.
If he goes into VF, his heart will stop pumping blood and he will go into cardiac arrest.
Just relax down there, Kevin. You're doing really well, mate.
That's the one I was saying where the heart just like fibrillates like this. It doesn't pump. So it's just doing this, which is obviously not pumping blood around your body and you're not getting oxygen to your brain.
It appears you're suffering from a heart attack.
Okay.
Yeah, mate, you got to listen to those feelings, hey? Yes.
We've heard that one before.
Yeah, that feeling of impending doom, that's what a lot of people say. The feeling of impending doom. If you hear somebody say that should prick your ears up.
This one is another one of those blood thinners to help with that clot, okay?
So mostly with these medications, we're trying to sort of hold fast and make sure that the clot doesn't get bigger and bigger and bigger.
Yeah, so it sounds as if they're giving like heparinization, trying to break down those blood clots where the platelets have started aggregating and like forming a clot, like you have a cut on your wound and it scabs over. That's because all these platelets kind of clump together, and this is causing that like blockage in his heart, and they are trying to break that down.
Because obviously if it completely blocks off that coronary artery, then there's sections of your heart just not getting enough oxygen and blood. All right.
There's another way you can unblock this. It's called an angiogram, where they go up through a vein, a artery in your arm or your leg, and they can go up and they can physically unblock it. But obviously you can't do that in the back of an ambulance.
Give me 2 seconds, mate. Grab that blanket off. So I'm just open it there.
Oh, too hot? Okay. All right.
Getting dizzy.
Oh, yep, let's lay down a little bit. Yes, you are getting dizzy.
Laying him down to increase his blood flow.
Okay, guys, he's in VF. So I'm just charging.
He's fibrillating again now, so he needs
pads, are they connected?
Pads are on, yep.
All right, guys,
Yeah,
we're going to do stack, shock, 3 stacks. Is everyone clear?
Clear.
Shock, charging. And we've got sinus, I think, but we'll just charge and stop at the thing. All clear, hands off, let's check. I think we still have a VF.
He's still in VF?
Yep. Is he awake?
Yep.
What the happened?
He's still in VF.
Rest, mate. Just rest your head back for me. Rest your head back.
He's still in VF. Is his eyes going back?
Yeah. Rest your head back for me, mate.
Can you feel
I'm gonna
pulse?
cardiovert him.
You see him just sinking in the bed.
No pulse. All clear.
All clear.
Charging.
Sorry, mate.
No, he's all
You're
clear.
Right, you're right, clear.
All clear. Okay, all clear.
Clear.
3 shocks. We're going to do stack, shock, 3 stacks. Is everyone clear?
Been in critical care for like 8 years on the actual critical care unit, and now I do like community critical care, where I go around homes with people with ventilators and various Hickman lines and things. It's a lot more safer than my old job, where it was CPR on you know 1 to 2 a week was common. But the shocking with the pads, it's still horrific to watch to this day. I don't know why.
Shock, charging.
Never get used to it.
I think we still have a VF.
Yeah.
Yep. Is he awake?
Yep.
What the happened?
He's still in VF.
Rest, mate. Just rest your head back for me. Rest your head back.
He's still in VF. Is his eyes going back?
Rest Rest your head back for me, mate.
The patient's heart has stopped. He is now in cardiac arrest.
No pulse. All clear?
All clear.
Charging?
Sorry, mate.
The blood clot has deprived his heart of oxygen, but somehow Kevin is still conscious.
All clear?
You're right, clear.
Okay, all
What a
clear.
machine he is.
3 shocks.
Has he even got oxygen on?
In all my years of being a paramedic, I've never
can't tell.
witnessed someone to be in ventricular fibrillation and still have a certain level of consciousness. Phoebes, I'll get you to jump out the back here.
Like I would have thought he would have 15 litres of oxygen on, but I can't see anything on his nose because they're going to start CPR now and they're going to pump blood around his body. But you know, the occasional breaths he is taking, he'll take in a lot of oxygen. You know, room oxygen's like 21. You could get a load of oxygen in this guy. So I don't know why the oxygen isn't on. I don't know what their rules and procedures are, but a human body is a human body.
Yeah?
Happy for me to start the CPR?
Yep, start CPR. I'm going to make a phone call for intra-arrest lysis. I want you...
Here comes the bag valve mask. This forces pressure into the lungs. When they put a mask over the mouth and they squeeze it, and it forces them to breathe. You can also attach oxygen on the back of this thing, so you're giving them like 15 litres of oxygen, which is really good when you're doing CPR, and it keeps that blood pumping because you want to get the oxygen into the head, because when the brain starts dying, you know, it can be devastating. I've seen people come back from having prolonged CPRs and they've unfortunately lost a lot of cognitive ability through lack of oxygen. But I would have had the oxygen tank up, ran up and put it on him when I was giving him drugs back up in his flat. But there you go.
Sorry, go again.
To bag.
You're right.
So we've just got a bit of consciousness with this VT. So last shock is 30 seconds. We're going to analyse
You're
at 2.
right, mate. You're okay. You're okay. You give some
It's not going to have too much effect on him with cardiac arrest. Okay, it looks like we've still got a VF, guys. I want you to draw up some adrenaline after that. You're analysing at 2 minutes and shocking if required. I'm making a phone call for intra-arrest lysis. So we all on the same page?
Yes.
The whole plan has now changed. My concern now is breaking this clot up.
You're doing really well,
Sorry,
Kevin.
honey, your heart's not
Okay, guys, I'm charging.
Yeah, keep doing what you're doing, mate, alright?
Sorry, Kevin.
Hey, Jay, Sophie from Logan Paul. Can I get through to the doctor straight away, thanks? Guys, all clear? Hands off.
Everyone clear?
Everyone clear? I see VF and shocking.
Sorry, buddy.
Hi, Sophie, it's Steve.
Hi, Steve. Hi.
I don't know about you if you got medical experience, but I still can't see oxygen attached to that bag valve mask.
Okay, sorry. We've got a patient here, confirmed STEMI, accepted for PCI. He's a 54-year-old male. We've given heparin ticagrelor. He's had a VF arrest. Currently had 3 stack shocks, 2 minutes of CPR with consciousness. He's now had another shock, still in VF. Calling to consult for intra-arrest lysis.
Sophie needs approval from QAS Medical Director Dr. Stephen Rashford to use a high-risk clot-busting drug.
Yeah, no, how long has he been in arrest for, Sophie?
He's still only 4 minutes, but he's still refractory VF.
Okay, no, how much does he weigh?
75 kilos.
Okay, so why don't we give him 40 milligrams of Connectipay? And, you know, just do another cycle while you're drawing that up and shock him. If he's still in VF at that point, give him the Connectipay 40 milligrams.
Okay, I have the medication.
I must say it's a lot easier for them to get through to a doctor than it is for me to get through to a doctor.
We're using to thrombolyse, called tenecteplase, is a pretty high risk medication. Obviously,
See, everywhere's got different names for different drugs, like venectoplase, as you say. There's like alteplase, and some others I can't think off the top of my head. But as she said, he's got a sleepy heart. You know, I've never heard that one. So you nurses who are going, you know, work in other countries, you'll have to pick up these things.
It causes bleeding because our intention is to break up a clot.
Everyone clear? Clear.
Still VF.
However, looking at the patient's current situation, okay, Jess, their heart's not beating, they're not breathing. The risk is that, yes, it might cause some sort of serious bleeding. You're doing good, guys, but the risk of not giving it is this patient's going to die.
All right,
We used this once on a prolonged cardiac arrest, and we were going for around 6-7 minutes, and then we put the injected with alteplase, and 40 minutes later we stopped because we just had no return of spontaneous circulation. But you've got to try everything.
And just don't push the amiodarone until we see if this works.
Yeah.
Yeah. So amiodarone is one of those drugs which they give during a cardiac arrest. Is fibrillating, and amiodarone just sort of calms down the electrical signals, just so they can try and get a stable heart rate back.
Okay, team, I'm going to charge.
Yeah. Pupils are constricted. He's still ventilating on his own.
All right, guys, hands off. Everyone.
Dan, hands off. Right.
All clear?
Yeah.
Okay.
Can we get it straight back?
Phone turn off.
Sorry, Kevin.
Okay.
Okay, tenecteplase is going in.
Our priority is to save this patient's life. So our priority is to administer what we need to administer, do what we need to do to save his life. Jess, can you take over CPR?
Yeah.
All right, we're charging now, so let's do it.
Okay, the bag valve mask is the bag's inflated now, so it looks as if he is getting oxygen. It seems that it was a long time before he had oxygen. It's just one of those things where it just helps a bit during cardiac arrest, especially recovery.
Put on the charge. This is something that is not a routine thing at all. It's quite risky.
Okay, please.
But at the same time, so is cardiac arrest, so is death.
Kevin's heart is not pumping on its own.
Ready, Ben?
Yep, go.
Okay.
The paramedics are the only reason he's still alive.
Yeah.
The clot-busting drug now in his system,
All right, and I'm going to be charging.
they have to keep their CPR going to give the drug a chance to work.
Yeah, that's the thing. They've given this alteplase now, or whatever they call it, and they put it in the vein. But if there's no heart pumping, that drug's just going to sit there. So they have to physically pump his heart, so his blood keeps circulating, so that drug has a chance to kick in.
Okay, all clear?
All clear.
I still CVF, you CVF?
Yeah.
Shock. Okay, let's push adrenaline, and can we push that amiodarone first?
Yeah.
Here we go.
It's in your pocket. Yeah. Thanks.
Yeah.
If the clot is cleared enough, each time they defibrillate,
Okay, we're charging.
there's a chance Kevin's heart may reset successfully and start beating on its own.
Okay, everyone clear.
These guys are getting tired now. It's so you rush in there, and your adrenaline is like through the roof, and you're like jumping on the, well, you do your assessments and stuff, but then when CPR is needed, you jump on the chest, and I tell you, man, 100 to 120 beats per 120 times per minute. This arms locked. You get tired very, very fast. And these guys have been on it now. They've shocked him 8 times. They've been doing CPR for 10 minutes coming up to. And you can see how ineffective the CPR gets. That's like these guys out in the ambulances are doing a fantastic job, because they absolutely knacker themselves by doing CPR after CPR after CPR. In ITU, somebody would start CPR and there'd be 6 nurses lined up behind you ready to go. So when you got tired, you can just swap and go to the back of the queue. It was very organised and a lot safer than being out on the road in an ambulance. But there's nothing else you can do. If somebody has an arrest at home without flying a hospital to them, we have ambulances and people get tired.
Confirming there. Yeah. Shocking. Cool. That's 9 shocks, so.
That man's still going. He's a machine.
All right, we're charging. Keep going, so keep going.
Still on the side of the road there.
Okay.
Hands off.
Everyone clear. Confirming VF.
Yep.
10 shocks And still, Kevin's heart hasn't restarted. He has no pulse.
Guys, we're probably going to start heading to hospital, okay?
CCP Sophie and her team are forcing the clot-busting drug tenecteplase through his body by CPR.
Okay, I'm coming in.
They're hoping it will break up the clot before it's too late.
We're going to have to be doing CPR on our way now.
The longer Kevin's heart isn't beating on its own,
Charge.
the higher the chance of his heart dying.
This is adrenaline.
Okay. All right, everyone clear.
Clear.
Confirm
Clear.
we're still in VF.
Yep, shock.
Ding.
I probably never thought about death before being in this job at all. And I've been in this job since I was like 20 years of age. Okay, I'll take over CPR and you can do some ventilations.
Just start moving. I'll get everything ready.
Did you see then how did you see then when they swapped over from the head to the CPR that this guy was getting tired and his beats were probably, I don't know, 50, 60 a minute, and then as soon as they took over, she went in, bang, 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 bang. And again, when that guy's had a chance to rest, and then she's slowing down because she's absolutely knackered, he'll come in and do bang, 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 and then he'll start slowing down as the lactic acid builds up in his muscles, and it just wears you out so fast.
Just gentle, Phoebe. It's quite a traumatic experience. Like, you're doing CPR, you're really, like, ribs break, like the patient can have blood start to come out of their airway. Like, it's a traumatic experience trying to resuscitate, trying to manually pump someone else's heart. Okay, guys, all clear?
Clear. Standing VF.
Yep. When you're in the middle of doing a resuscitation, you are just thinking so clinically. You've got an outcome you're trying to achieve, and although there is some emotion about, this person is in cardiac arrest. Okay, back down. Let's analyse. You want to try save their lives. Yeah, shock it. All right, keep going. Nice firm CPR. Let's try to push that tenecteplase
This guy's been down for a while now.
around. I've got a whole team that I'm guiding. You can't just be emotional yourself, because your job is to be their pillar so that you can be strong for them.
I think looking back on these videos, especially when they put like the background music on, like sad music and stuff, I start feeling it. I'm like, oh my god, this is traumatic. On the verge of having tears in my eyes. But when you're in the middle of the situation, there's no background music. There's no tension music. There's no sad music and violins playing. It's just very organised and very your job, and you sort of debrief after. But the way this is being portrayed with the music, it does develop emotions in people as they watch this. I suppose that's why the music is there, just to make it more emotional, I guess.
The outcomes can vary. The outcomes can be really great, and that person might walk home versus that patient might not survive at all. So our priority is to do what we need to do to save his life. All right, guys. Still no pulse, still VF. He's had 13 shocks and CPR. We've got metronome core patch. He's had 3 adrenalines, 450 of amiodarone. He's had 40 of tenecteplase, 6,000 of heparin, 180 ticagrelor, 300 of aspirin, and 50 of fen. Is that correct?
And 8 of on dance.
And 8 of on dance. Okay. I really hope that we can get this patient.
So there's lots of anti-arrhythmic drugs there. There's lots of clot-busting drugs, pain relief, sedation. So he's got lots of oxygen on board.
Patient to hospital in a state that he can get the cardiac care that he needs. Okay, Jess. Once you've done that, I need you to give.
You see that CPR now, one-handed. She's trying to do all the jobs, draw drugs up. I'm so impressed with what they are doing, because I don't think I can do it. I couldn't deliver that sort of care. It'd have to be. I've been lucky enough to be in the hospital with that team behind me. and it's just swap, and the CPR is bob on at every time. This is no criticism to them. There's 3 of them trying to work this prolonged cardiac arrest, and they are doing a fantastic job.
Half a mil of this. We don't just want patients to survive. We want patients to survive back to normal outcome. We'll lower the stretcher down and everything, so we're good now.
You good still?
Yes.
This is down. I'll take it.
Okay, lower the stretcher. Okay, guys, wait, let's connect the O2. I got the bag.
Okay, O2 is connected.
Okay, guys, let's stop. We need to stop. We're going to charge. Phoebe, charge.
I'm such an oxygen like fiend. I don't know why. Whenever something kicked off when I was like new into critical care, say somebody went down or the rhythm went all funky, the first thing the sister would do was, Andy, get the oxygen on. So it'd be so. I don't know why, but I'm just an oxygen fiend.
Okay, guys, stop. Rhythm analysis. I've got a pulse. It's a rate of 20. Cancel shot. Continue CPR.
Okay, let's go. Yes.
Rate of 20. I can feel a weak carotid pulse. He's alive.
That's a good sign. Okay, so unfortunately this clip ended there. His pulse returned, although it was really thready, just as he was being wheeled into A&E. It's a shame that they don't give you outcomes. I might have to start searching outcomes and put outcomes on the end of this. It's a good thing that he's got a bit of a pulse back, but the realistic outcome of him returning to normal life after this is very slim. He'll probably end up on critical care with that weak pulse, intubated, while they try and sort his heart out, and they take him off to cardiothoracics and either go in with an angiogram or do some open chest surgery like bypasses and things. That's his best chance. It would be nice to find out what happened to this guy. So if anybody knows, drop it in the comments below. And well done to all these ambulance staff. They worked their absolute arses off, and well done.